Welcome to Unstitching ADHD Urban Ed Talks. I'm your host, Dr. Stanley Ekiyor, and today with me I have a special guest, Dr. Michael Goldberg, MD, a pediatrician whose practice focuses on neuro-immune health as it relates to special needs children, including ADHD. Welcome, Dr. Goldberg.
It is my pleasure to be here today as I found myself focusing massively on the ASD field, the autistic spectrum, coming back into the ADHD field. It's all starting to tie together that I believe as a pediatrician, a lot of the children we're working with today are ill. I don't believe it's how they're born autistic. And even more important, from working days with neurospec, I believe ADHD is being potentially classified in the wrong way. I will explain. I trained in medical school, UCLA, USC, that excellent professors. And I will never forget a professor talking about ADD then, this was in the 70s, mentioning that these hyperactive, hyperkinetic children, I'll come back to this, but the literature today says they were quiet. That's not true. In the 70s, it was the hyperactive ADD. What I was taught is critical. These children were normal, they were healthy. There was nothing wrong with them if you could keep them in their seat. They were hyper, but in their seat, they were brilliant. And the big point made in medical school was these children did not have soft neurological signs. They didn't have cognitive issues. They didn't have motor issues. Now, skip ahead. Unfortunately, I watched this in the 1980s as the psychiatric field started having a bunch of kids presenting differently. We had all the labels: mixed ADD, quiet ADD, ADD with hyperactivity, D without hyperactivity. And I believe all of that began to miss the real problem. Most of those children are not completely healthy. That was documented on Neurospec, who, if you did a Neurospec scan, showed basically a normal brain, some areas of hyperness. ADHD child almost universally has a component of temporal lobe hypoperfusion, and it makes them a little duller than the healthy child, not as quick to respond as they should be. I'm prejudiced, but I believe it's a medical condition that we should be helping those children with.
Before we go deeper into what you have raised, I would want you to briefly explain to our listeners what neuro-immune means and how it relates to children with ADHD.
Oh, completely. I'm glad you're asking. I started off as a regular pediatrician with thankfully a lot of good background, training places like UCLA, USC, got introduced to what were called higher order herpes viruses at the very early days of talking about them. When we talk about roseola in a child, that was due to something called HHV6, HHV7, HHV8. And that was the introduction to what these viruses do to our brain. I was taught that the viruses go to the temporal lobe of our brain, which is very fascinating with the problems going on. From that background, came into practice in what I believed was a very good medical world. And then my wife became ill, which was my introduction to chronic fatigue syndrome, which was the opening to neuroimmune. While the system tried to say these women walking around with elevated viral titers had nothing wrong with them. Thankfully, I had become involved with Dr. Mena neurospec work, and neurospec work showed temporal lobe hypoperfusion, I didn't believe my wife was a malingerer. I believed her viral titers were important. And as I began to attend conferences, it was my introduction to a complex new field of medicine that we have termed neuroimmune, which is a polite way of trying to describe what our brains do regularly. Think about how I say this. My opening point is whenever we get a cold, we're zony, we're spacey, we're tired. But I use the example. This was the introduction. A cold doesn't go to your brain. So why do we feel that way? And that was the start of learning. As they argue, we are designed intelligently, and we have this neuroimmune system in the brain that actually shuts down blood flow to key parts of the brain. Think of it, the body that's being invaded by a foreign invader. We shut down to protect the brain, but normally, 4 or 5 days later, a week later, you become well, and your brain opens up again. The early days from chronic fatigue to starting to look at this mistake of ASD in children led to the opening that put enough stresses together, and this neuroimmune system goes into a chronic shutdown. And I apologize for some of my frustration, but if I say to you, this was actually discussed scientifically, 1992 NIH meeting, where I will never forget this. They were, of course, me making fun of these women with chronic fatigue. I will never forget that they spoke up. Some of these women may really have a problem. They have low NK cells, which sets you up for viral activation, unfortunately, cancers. And they discuss the fact that you put enough stresses together, this neuroimmune system goes into an autoimmune shutdown. So I believe strongly the science is there. Working with neurospec, everything became explainable. That hyper ADD kid, healthy brain, some hyperness. But the ADHD children, and most important, your ASD children, consistently show a medical shutdown that we can treat and help. That's the key to this. And many good educators do great work. I'd like to see us get back to a medical system where we give you healthier children and brains to work with.
That's a different area we're walking into now. What do you think from your experience with you working with children? What are some of the early signs, though, of ADHD that parents and teachers might miss from
Okay,
your lens?
okay, let's start. Let's take the extreme is
Yes.
ASD, mistaken that we're calling autism out there, which are children that are incompatible with the ideal of what was originally can or autism. And in those parents, I explain it's pretty obvious, somewhere around 12, 15, 18 months old, that bright eyed, alert child becomes more zony, more spacey, more withdrawn. That is this neuroimmune system shutting down in that child. Now, an ADHD kid may go along for many more years without something dramatic showing up. But ultimately, if we look, the children are not as sharp as their peers in their brain function. We know they're intelligent, but they're often slower. They're not processing as quickly as they could. And rather than calling that a form of ADD, ADHD, I believe it's a medical problem first. We should be trying to help those children and then turning them over to the educators to fix things up from there.
Mm, mm. So when you say a medical problem, right, kids see their medical practitioners and at times they are diagnosed. Is that what you're referring to as a medical problem? Is it kids who are on medication? Is that what you're referring to?
No, no. What
Mm-mm.
we're doing medically, I believe what we are doing medically with many of these children is hurting them instead of helping them. I have to go back to excellent professors, and I will never forget this lecture. We give these hyper children stimulant medications to calm them down. Do not know why it works. I can tell you now from the neurospec why it works, but taught you would never give those medications to a teenager or adult as they are habit forming and very negative to the brain. The simple statement is all of your stimulant meds are the equivalent of cocaine on the brain. So when I say medical, I mean very different. I look at the fact to go through school to succeed in life, a child has to be healthy mentally and physically. And what goes back to the 80s with the adult chronic fatigue, the start of this ASD, ADHD pandemic in children, is the fact that the medical system has ignored chronic viruses I was taught about in medical school. My position is if neurospec and blood work confirm one, a virus, two, a stressed immune system, and the spec work, I don't do them all now, but I was doing them regularly then, temporal lobe hypoperfusion. My ideal of medical therapy is one, the virus. If there's something suppressing these children, creating that dullness, you've got to suppress it. So I treat the virus. Unfortunately, a huge part of ADD, ADHD is food discussions. I think we're missing an awful lot on food because of the disease process. These children are very sensitive. Yes, old fashioned ideas like red dyes may set them off more. Any food that gives a child a dark circle under their eyes is hurting their brain. And it's very stressful. A lot of teachers I work with talk about literally how many space cadets are in their class. My first goal is at least recognize if there's a medical condition, you treat it. If there's a virus, you have to treat it. It's very difficult, but food issues have to be cleared. They stress the brain, they stress the child. Some physicians are doing this, but in my case, because of the temporal lobe hypoperfusion, I use SSRIs a lot, not to control or regulate a child, but to get the brain working and get them bright. Okay? Tell you with a smile, had a couple of recent ADHD patients. One of them, a 15-year-old girl with the start of therapy, can now watch a movie that she could never watch before, and a 14-year-old boy that can ride a bike. This, I believe, is what we're missing. ADHD was supposedly processing in the brain. How come so many children today are having motor issues? They can't ride a bike. They can't do things that we very normal. I believe part of fixing this educational crisis is starting to get every child we can healthy, alert, giving you and the teachers a better chance to help them.
Yeah. So if I'm understanding you clearly, Dr. Goldberg, what you're saying is um, the way ADHD is being looked at right now is not actually looking at the root
Correct.
cause that is medical, and that is what should be addressed rather than accepting and controlling it.
This is my hope more than I can say to you that if we wake up, that when I went to school, I'll dare say when you went to school, most children were healthy. Kids were bright. I chose pediatrics. Children are supposed to be bright eyed, sharp, alert. The joke was better protoplasm than adults. So when parents know this, the children wake up tired. The children can't do many things they normally are expected to do. I'm prejudiced, but I believe their first job as a doctor is help that child become healthy again and then give you and the educators a much better child to work with. And yes, I believe a majority of ADHD is a medical condition.
So, from your experience, what specifics, right, have you seen? What specific examples that you can give that you have really addressed or you have really worked on, and the results have been positive for you to share?
Okay, I can give you a large number. Most of my working has been ASD children, so let's take that as the extreme. Unheard of. I have many ASD children in normal classes, honor classes in high school, and normal college classes by helping their brain to recover. I did a lot of work with ADHD originally, haven't focused as much with the kids on that, but as I'm seeing more children with ADD, the process in each case becomes, can I help that child become as bright as any normal healthy child? The problem was medical, not how they were born.
Okay, let's do this. What will be your advice to parents who are listening and are caught between the different um, viewpoints, especially when it comes to the medical area, which I am not an expert in and will not be able to actually.
You're doing great.
Oh,
Literally, no,
thank you.
literally. This is my first time, and I'm very pleased to get to speak with you. I've been fighting now for years. The medical system made these mistakes. Children didn't have these issues in the 60s and 70s. So, what a parent should start to look for when you say that, if a child happens to be that bright, alert, intelligent, old fashioned ADD child, I'm not a fan of stimulant meds, but in the younger child, there may be a place for that. On neurospec, we have evidence that that child did have hyperness in the frontal lobes, pretty much normal rest of the brain. My advice to a parent today, if their child does not fit, if they're in their seat, very likely there's a medical issue going on. If they're not fully bright alert, they're not as sharp as the other children, something's wrong. Now you're touching on what I'm hoping we're on the verge of having a chance to fix. These parents have been left out there for years. And the medical system, I'm going to openly say it, I believe some really bad people decided many years ago to ignore these viruses, and they explain everybody's dysfunction. We have labels: chronic fatigue in adults, long COVID in adults, autistic symptoms in children, ADHD symptoms in children. What I'm hoping for, if you start with the extreme, it's very almost becoming simple to say a child with autism was never normal. And while we used to make fun of psychiatry, I give psychiatry of the 70s a lot more credit. They said if there was organic illness, you couldn't get a label. Many of the ASD children today, many of your ADHD children, motor issues. Any child with motor issues is a virus till proven otherwise. Now, the parents are going to get very frustrated because the medical system is not testing for those viruses. But I do believe we're on the verge of a chance to fix this. RFK is misdirected by, I believe, the conferences he's attended, even those surrounding him. For the first time, RFK, President Trump, want to help the children. I am praying if we get the right fight, the medical fight, There will be a way to do that, and we can honestly get back to a healthier population of children, and I hope a much healthier future.
Okay. So when you talk about they are not testing, what kind of test or check are you talking about that might be able to point to some of these
Okay,
viruses you're talking about?
good question. And I know I'm saying things very different, so please keep
Hmm.
questioning me.
Yeah.
If I say to you, in a good medical system, if a baby presented with motor issues, you tested them for a virus. The viruses were things like HHV6, CMV, herpes related viruses. If you look at the children today, not one test like that is being done. The children I see that come to me have never been checked for that. What I hope we'll get to, you recognize the problem, starting with the extreme ASD. It's all going to apply to the ADHD children. The only totally objective test is a neurospec test. And this was a tremendous help. Dr. Ismail Mina was a genius. He's passed away, unfortunately, but he was a genius in neurospec. Dr. Bruce Miller is a genius in adult dementias, identified what self is. And he could take a neurospec scan and tell me everything that was working and not working in those children, never having met the child. This is what we're missing out. If you take a child with ASD or ADHD, do an MRI, most of the time it will be normal. They don't have real brain damage. If you do PET scans, you get a lot of conflicting information. If you do neurospec correctly, it is a flow and function of the brain. I have been thankfully very spoiled by that. I believe if we're going to label children with these labels, they deserve the technology to validate what their brain is doing. And the medical system has not been doing that. So if we start looking for viruses, medical issues, immune sensitivities explain a lot of the food issues, and then understand the brain, you can document objectively. Is the brain working or not working correctly? Everything I've ever tried to do from that medically is as a pediatrician. How do I get the brain to work correctly, bring that child back in our world, and get them healthy? Thankfully, a lot of good success.
Oh. Now, do you think there is any place for behavioral therapy? For instance, uh, most times people talk about the skills they are missing, right? They talk about the self regulation and short term memory and their inability to regulate themselves. Is there anything around that area that you think can be a problem, a challenge too, that can be addressed?
Okay, let's qualify that.
Yes,
I
please.
think that if any child that you're working with who's having problems, a good educational person, a good therapist, can work with that child's deficits, that child's issues, and can help somewhat. But I will say I remain prejudiced. If we can have that child's brain healthy, it's easier to help them. I think that I have a lot of respect. My only problem, I might welcome your input. My only big problem, especially with autistic children, I remember good education. You
Yes.
ran into a problem. You had to fix or solve it. Okay. The extreme ASD, the minute a kid can't do it, they refocus, redirect them. And personally believe that's a bad idea. Even if the child's having trouble, an ADHD kid, I would like to believe you want to help them succeed so they can have belief in themselves in the future rather than look at that like I can't do it and I think become afraid of it. Welcome your input on that.
Yeah, that's what I think the labeling, the misunderstanding, the myths around it. I personally don't believe changing or fixing people or children is what we should be doing. What I mean by fixing is making somebody almost be like me, think like me, or do things the way I do it. If there is a medical condition that needs to be addressed, which is the root cause, so why you dance around the symptoms without going to the root cause? I'm wondering how, when it comes to self regulation skills, which has to do with the brain,
Right.
how can we address that without actually changing this person?
It's
Now, you say, yes, the brain cannot function because there's an underlying medical condition which you are relating to viruses, right?
viruses. The right word to use is complex immune, complex viral. It's a
Okay,
shutdown there.
all right.
But when the temporal lobe of the brain, this is the key
Mhm,
part of that neuroimmune system, when
mhm,
the temporal lobe shuts down, it's itself is not regulating the frontal lobe right. We look
mhm.
at the dysregulation of that frontal lobe. We haven't been looking at, can we help that child be medically healthier? That once you've done your best, you have to work with that child and help them succeed with whatever their issues may be. But I believe we're giving you children with more issues than they have.
So, how can, because this next question I want to ask, since there are people who will disagree with your point in the medical area too, that might say, oh no, this is the area we're going. Can doctors, especially pediatricians, work with schools with these differing views, which I'm thinking there's still a balance, there's still a center. Because you make a valid point if you have the research to show that if the underlying problem is right here based on your expertise, and if that is not addressed, then chances are we're just dancing around. So why don't we go
Correct.
back to the exact point, right? How can those of us in education that are at the forefront, parents are confused because there's so much out there and it's stressful and challenging for them. How can pediatricians actually help schools and parents to find a workable solution?
Okay. I believe this is all 35 years of a medical system. By ignoring these viruses, you have
Mhm.
created chronic disease. And again, I'll say complex immune, complex viral, but by
Yes.
ignoring this, you have created chronic dysfunction in adults, and most important to me and you, probably chronic dysfunction in children. Now, you said it right. I know for years now the medical world is denying these viruses. The whole issue, and I'm hoping we're talking at a time when there's going to be a chance to start to fix this. Well, ADHD is wrong to me. A child I trained on in medical school didn't have processing issues, didn't have motor issues. Again, ADD was actually a very bright, hyper kid, though, and this is a little terrifying. Preparing for this talk today, I went back and said, okay, what are they saying about ADHD out there right now? You ready? You look up the literature. This is terrifying. They're saying ADD was a hypoactive child. How can they say that? I have textbooks on the shelves that discussed ADD was the hyperactive kid. And I believe this is part of the problem. The medical system has thrown out viral teaching I was taught about. Within the psychiatric field, they're changing the criteria. So my hope is to start with the extreme of ASD. If it's very simple to say at this point, Canner criteria was a child that was never normal, never affectionate, absolutely had no motor issues. I am cautiously optimistic. Get that out there, re-raise the point that these children do not have autism. I'll give you a cautious optimism. Everyone knows my frustration. This has been very difficult. I really believe we can do a lot more to help these children and families. And I go into a high level pediatric professor who's in the ivory tower. And this is my optimism for all of you. His first words were, Mike, I have nothing to do with autism. I go, great. And then I will tease in less than 20 minutes. He had the right answer. What I'm describing in these children is an ASD phenotype. What that really means is a medical disease with some autistic symptoms, not autism. We get that switch out there, and I believe everything's going to open up to the goal is getting back to healthy children, and then with a healthy child working with their issues to help them learn, to help them succeed. But most of those kids will have good brains if we do it right.
Hoping people will listen and maybe challenge, and will have a very robust and healthy conversation about these issues. Interesting. So, what are the tools, though? Let's think about, because you have addressed some of the myths. You
Mm-hmm.
believe the way they are going about it is wrong, and the right way is going back to the medical. So, should we still be thinking medication?
Okay, what I would tell any parent, and there is a chance, even though the overall focus needs to be fixed, many doctors are more open lately to trying to help a child. Any parent with a child dealing with this should think about. Number one, biggest issue is foods out there. I think that any child with dark circles, the neurospec shows the immune system is actually irritating the brain. This is consistent with seizure literature that says you irritate the stomach of a mouse or rat, brain becomes more vulnerable to a seizure. To me, the first step with any parent doing everything they can to get rid of dark circles. That usually means no dairy products. You have to be very suspicious of the grains out there. It used to be I could tell a family processed white rice, processed white flour, and you did away with a lot of the food allergies. I will complain because of the GMOs. Processed white rice, processed white flour doesn't stop the problem. So, the first step for any parent, if you're looking at trying to help the child, think of diet first. You want to do everything you can to get rid of dark circles. And then, of course, you get into the old things, avoiding red dyes, try to cut sugar loads, we all know about. Now, after a parent's done that, let's assume this is not that bright, sharp, alert, healthy kid that's hyper, but rather the kid that's a little zony, the kid that's still not quite as sharp as they should be. Instead of turning on that child to a Ritalin like drug, if they can ask their doctor to consider an SSRI, it turns out the SSRIs were not invented for this problem. They were the new wonder antidepressants. Instead of suppressing the brain, they do one thing: block the reuptake of serotonin that the brain is producing normally. As I explain to parents, I am never, ever using a medicine as a pediatrician to regulate a child. But if you titrate them with the SSRI for brightness, for sharpness, and do it carefully, you can help bring that child back into our world in a much healthier manner. And before we get to the viruses, we need to get to the reasons. We need to get back to a medical system to make these children healthy. But for now, any child having a problem, if parents would focus on the food and diet, and if they're not a hyper child, instead of Ritalin, think of an SSRI. They are the other choice for that non hyper child, also something called guaifenesin, old fashioned 10X. Those are much more benign on the brain than the stimulant meds are.
Hmm. So, the present diagnosis process, the process of diagnosing AIDS, you are challenging it. You think it's wrong?
Yes. I will say to anybody, if I chose pediatrics because children are supposed to be bright eyed, healthier than adults, the joke is healthier protoplasm, then in a simple manner. Any child walking around who's not bright alert, healthy sparkle in their eyes, physically coordinated, or having motor issues should be looked upon as a medical condition till proven otherwise. Back to that, we need to help those families and children correctly, and then hopefully give you, educators and teachers, a better child to work with.
Mm. Mm. This is interesting. I hear you going back to looking at what we eat, what we provide for the kids, even though there's this school of thought that says food actually barely the dye barely has anything to do with ADHD
But
and
that, but that's the mistake.
mhm, mhm, mhm,
My wife makes a joke. Food is the most common drug we take,
mhm,
and I've touched on it. Let me share with you. I believe inadvertently that GMOs may be the biggest disaster in life, but not for the reasons people are talking about. I don't believe the FDA would release any food that you could measure a toxin, measure something wrong with. Okay. So if you take away all those fights, what I believe is really happening based on blood work with the children, markers I see that I never saw before the GMOs, our bodies think they are foreign. I use the example. Humans evolve over millions of years, wandering around the desert. What protected us? Our stomachs. In theory, you vomited out what wasn't good for you. I believe now, watching this for a long time, the simple explanation is going to be, at least for many people, these modified foods are foreign. Our bodies are trying to get rid of them. I don't believe it will be a toxin or something specific. I think it's a much simpler point, human evolution.
mhm, mhm,
And again, I would come to the point for any parent, you want to go out of your way to have nobody in your family with a dark circle. That's the problem with the foods.
mm. Okay. When you talk about dark circles, how can a kid, and forgive me, I'm not a medical expert if my
No, no,
question sounds ridiculous, but
you get many bonus points
yeah.
already that you're looking at this. It's time to fix this. So you get
Yeah.
many bonus points.
So, how does a parent with a dark skinned kid, for instance, how do you see a dark in
Great question.
looking at me? Yes.
Okay. And I'm going to share something with you. All of this goes back again, the ASD focus. And I remember when you heard the fight. Oh, it's a disease of society. Remember those fights and arguments out there? Guess what? When they were doing that, I had families from Ethiopia, families from Africa. The mother from Ethiopia was calling all of her friends in Africa with the problem. So I don't believe in any way this is a disease of civilization. I believe it's affecting many, many people. And you
Yes.
ask a very good question. What I tell a parent is you compare the lower lid of the eye to the cheek. The
Mm.
lower lid is darker than the cheek. That's a dark circle.
Oh,
Okay? Doesn't
okay.
matter who it is.
Okay. That makes a lot of sense.
Yeah.
What about screen time? There are people who believe too much of it is bad for kids, but what about kids with ADHD? Because most times you see some of the strategies or solutions out there use technology that impact or affect their daily
Okay.
activities.
You're touching on a very good topic because as I share with parents, I'll tease you, much older than you. When I was growing up, all parents talked about was boob tube, TVs.
Mhm,
It was always the question of too much time, wasting too much time.
mhm,
But there was never a question of miswiring the brain. I believe there have been too many points raised that can this technology rewire the brain. So,
mhm.
what I do consistently with the children I work with, make the screen time contingent upon them doing their academics. If they're doing good things for the brain, including reading, I think that helps counter some of the negative. But I don't believe they should have unlimited screen time unless they're because that's a smart kid. If I jump around on you, so many ASD children are brilliant on computers. But I tell parents when I graduated medical school, a place called UCLA, we were not so politically correct. We labeled children MR, mentally retarded. I can promise you there's no child we ever called who was going to do better on an iPad or computer than mom and dad. So the issue with screen time is one to understand. Most of these children are brilliant. The difference is you need your brain working to learn, and then screen time can be a supplement of fun for a child. I know there are techniques, you've dealt with them. They're using electronics to help a child learn. I'm not opposed to constructive things. I just think the unregulated screen time is a problem.
Thank you. Most people will agree with you. This is very interesting. I'm beating myself right now is that I'm not a medical expert. I hope I'm asking the right questions to help my viewers, and I hope this might lead because this is new to me. This is interesting. We're trying to unstitch, like the name says, unstitch ADHD. It gives us opportunity to bring, experts like you to the table to talk about it from your lens and what you have done, your research, and what you're finding out, so that we can have constructive discussions, robust discussions to address this issue. I'm happy we are doing this. What I want you to do for me is to tell my listeners and viewers, summarizing what you see as the struggles with the way we are addressing ADHD right now and what solutions you prefer. I know you've talked about them, but just briefly so that if somebody out there thinks they have or they want to challenge it, we give them the opportunity to come in. And who knows? Maybe somebody will say, you know what, I want to sit in with Dr. Goldberg. Let's come together and have that
I
conversation, and I'll appreciate.
I will be very happy to do a follow up with you in
Yes,
any
good,
way constructive,
good.
absolutely. And you're hitting their points. I've watched this for years. When I first had everyone going, okay, Mike, be careful what you say, make sure of yourself. I was a lot happier than I am today when I have many people going, okay, Mike, we hate to admit it, making a lot of sense. But as I'm making sense, the good news is while the medical system is not fixing this, I believe it's a major problem for adults and children. The truth is, while RFK is misdirected, both he and Donald Trump want to fix this. So for the first time, there's an opening at the top. I think it's time for parents to come together. Again, I look at the extreme as ASD, but even ADHD, training in a good system. Any parent who has a child that is not alert, not healthy, not bright eyed like they should be, should begin looking for medical solution. I think if we begin to get pressure out there, it's going to be time to do it. I'm hoping. And then what I said, in the meantime, if that child is dull at all, has dark circles, think of foods first, and then think of trying to work with the doctor for helpful medicines, which is to get that child back to being brighter, not to control them, to get them back to being brighter. But I really am praying we are on the verge of a chance to open this up and fix it.
Thank you so much, Dr. Goldberg. Unfortunately, we have had you for so long, even though I promised it was going to be short. Thank you for taking this time. It's been a very exciting conversation, and thank you for sharing your insights and expertise today. Your
Thank
work,
you for having me here today, and count on me as I'm ready to do whatever will help these parents.
yes, and your work and what you have just said reminds us of how complex, interconnected ADHD is and how critical it is to approach it with medical and community care in mind. To our listeners, stay curious, compassionate, and unstitch ADHD with us each week. Please feel free to comment. Dr. Goldberg is ready to come back. So if there's any person out there, that has the medical expertise to challenge him and have a robust conversation, we will welcome you. Dr. Goldberg, thank you. I appreciate your time, and hopefully we will invite you back again. Appreciate you. Thank you. Bye.